All right, hello folks. Today we're going to be learning how to measure your arms. And these measurements are really important to get a baseline for you about how big around each arm is. And the earlier you do this, the better. So you know what is normal for you. If you can do this before surgery, that's best case scenario. But even if you've already had surgery, get some measurements now. And this is especially if you haven't been able to see a therapist or a certified lymphedema therapist. If you haven't had that kind of professional consult, this is a good way for you to assess yourself, and then you can notify your oncologist if you need some help or some guidance. And we want to know how big around the arm is compared to the other side. So in case you start to sense maybe it's swelling and you're not sure, your measurements are really going to tell you. And so we'll get baseline measurements today to see what's normal for you. And it's normal to have one arm bigger than the other already because we'll have a dominant arm if we're right-handed or left-handed, or one that we just tend to lift more with. Or if we've ever had an injury, we may have a smaller arm on the side that's had an injury that we don't use as much. After surgery, you're likely to see some swelling in the upper part of the arm more, maybe even the lower part of the arm, but that should go away within the first few weeks. And so that's just something to just be aware of. Swelling after surgery is normal, but it should diminish and go away. We want to recheck these measurements periodically. One of the signs that you would want to recheck it is if you're feeling heaviness in that arm, you're feeling jewelry or clothing is tighter there than it used to be, or it's not tight on the other side, or you're having tingling or fatigue in the side that had lymph nodes removed, the surgery side, that isn't normal for you, and it isn't the same on the other arm. So if you're having any of those symptoms, you want to go ahead and check the measurements. And if you're seeing a difference of more than 2 centimeters, 1 centimeter to 2 centimeters bigger on the surgery side, then you want to talk to your oncologist and ask for a referral to a certified lymphedema therapist. That's really important. Okay, here's how we measure and get the baseline. And this PDF of the chart on how to fill out your numbers will be included as an arm measurement form. And we're going to measure around the knuckles, and then we're going to measure at 10 centimeter increments up the arm. And I would do both arms, but you're just going to see the left arm today. And I start with my marking my 10 centimeter measurements by looking for the first crease on the wrist. And if we just bend Wanda's wrist slightly, we will see the first crease right about here. So I just draw a little mark at that first crease. And then we measure up from there. So I take my tape measure and I take it to the 10 centimeter mark and I put it on that first wrist mark. And then I draw another mark there. Put the 10 centimeter mark here. There's my second mark. And then we're going to get one more. And now depending on the length of your arm, well, good. So she just helped because their arm was bent and there was a gap. So I was going to have to press that down, or she straightened her arm so that we don't have that gap up right in here at the elbow. So one more mark. Now, if your arms are longer, that you could get another mark right up before the armpit. So you wouldn't want it up here because that's not in line with the armpit. So we want to make sure that it wouldn't be any higher than that. We could probably get close to another measurement here. Let's just see where that lands. Yeah, actually. We're going to get one more measurement right up there. But it can be 3 or 4 typically is what I'll see. And then on the first measurement, we measure around the knuckles, because oftentimes if lymphedema is starting, it may start in the hands. And so I'll have people make a fist with both hands, and if you see that the knuckles are disappearing a lot on one hand but not the other, that might be a sign. But this measurement is another way to do it. So we take the tape right around the knuckles, and I just ask you just to relax your hand. You don't have to push it down flat or anything, just relax it. And then when I measure, I just take the slack out, but I'm not squeezing tight. I'm just making sure that there's no slack in the system and try to have the same amount of tension pulled each time. So this one I'm getting 17.2. So over here under the knuckles, I'm going to put 17.2. And then the next measurement, it's not exactly where we did the mark on the wrist, but we want it to be right over the wrist bone. So we want the tape to come directly around the wrist, right where the wrist bone is. We call this the ulnar styloid. And then I'll pull the tape again, just snug. So I'm not squeezing so it's leaving a dent or squishing the skin. I'm just pulling it snug, and we get a 13.8 there. And then I'll flip Wanda's arm over, and we'll start coming up to the next mark, which is the 10 centimeter mark. And on your form, it says 10 centimeters. And so you come right up even. So I probably have the top of the tape measure just even with that mark. Again, take the slack out. We got 18. Good. Relax your arm down. Great. So we do it the same way every time. 23. Trying to get nice and level here. 26. Nice even numbers. And 28. Just like that. So using the same amount of tension, keeping the arm relaxed, not contracting the muscle, and just getting your numbers. You would do that for both arms, and you will see a difference. Our arms are not the same, but you will see a difference side to side. If you're worried about swelling, do those same exact measurements again. Compare it to what you got today on your first time. If you see 1 or especially 2 centimeter difference on something, let your oncology provider know that you think you have some swelling developed and that you need a referral to see a certified lymphedema therapist. I hope that was helpful. Thank you.